Okay, there we go. And as I do that, I'd like to introduce our speakers, John Rodis and Kathleen Kane. John is president of the Foundation's Massachusetts chapter and is chair of the chapter's Physician Awareness Committee for Marfan and Ehlers-Danlos syndromes. A national disability and medical advocate for rare disorders, John also serves on the Winthrop Disability Commission. In addition, John is the founder and co-head of the Ehlers-Danlos New England, Massachusetts support group. Kathleen is an attorney who has devoted extensive time to representing people who have been denied Social Security disability benefits since her husband, the aforementioned John Rodis, became disabled. She has been successful in obtaining benefits for Marfan syndrome claimants in many states and serves on the Foundation's Quality of Life expert panel. So I welcome John and Kathleen, and I'm going to go to their first slide, and I'm going to try to pass them the remote control. And hopefully this will work, and they will be able to have control of that mouse. So, okay, John and Kathleen, it is all yours. And if the mouse doesn't work, just let me know, and I will advance the slides for you.
Okay.
Thank you, Eileen.
Do you want me to try to double click on here, Eileen?
Yes, please.
Come on, open up. Still hasn't opened yet. Let's see. Try view options. See what that does.
I don't know, but if you'd like, maybe we should just move on, and I will advance for you.
Let's just do that.
Okay.
That way, just yeah.
Okay.
Thank you.
I don't want to take people's time. Okay. So advance. Okay.
Okay. Thanks.
Sure.
Okay, so thank you, Eileen, again.
Yeah. Thank you.
The first thing that we want to talk about is the two different types of programs that are available under the heading of Social Security Disability. There's Social Security Disability Insurance, which we refer to as SSDI. This is for people who have worked and who have put into the system over the years, and they've gotten what we refer to as an insured status. This is the same pool of money, so to speak, that is your retirement Social Security. And again, you're putting into the system by working and by how much money that you make and how much money is taken out for the Social Security system. There's also supplemental security income. This is for people and children who have some type of financial need. And because of that, you have to have limited income and resources in order to be eligible under SSI. One of the questions we had earlier was actually from a family in California whose son is on Social Security, SSI, and because he and his wife have made more money, they are telling him that the son is no longer going to be eligible. And unfortunately, that happens sometimes, and it's not something that can be appealed or can be fought, because it's basically a kind of like a line in the sand in terms of what your income and your assets are. It does vary by state, so it's kind of based on what a state's cost of living is. But unfortunately, that's one of the disadvantages of that program. You can advance, Eileen. So one of the first things, especially if you're considering filing for SSDI and you've worked, is just making the decision to file. And because John has actually gone through this, I'm going to have him speak to some of these considerations.
Yeah, and the first one is health considerations, which is really the most major thing. Although not saying financial and emotional, of course, they are as well. But when you're not doing well, you're not feeling well like I did, and realize that continuing to work would put more and more strain on the body, strain on the mind, and you can get sicker, and God knows you could lose your life. So health considerations are very important. Something that if even especially if you're married, discuss it, or with your significant other, discuss it, go over how you're affected, what's going on, and really talk it out, because yes, everybody wants to work. I wanted to continue working, but if it puts you in jeopardy, then you really need to file. So health considerations is a major factor. Financial considerations is, of course, just as important because nobody wants to go from a salary, a decent salary or a salary to a very small salary. Because even with SSDI, the amount of money you're going to get is not very big. And when I went and decided to file, and that leads to the emotional considerations, it was extremely difficult. I mean, I think I was telling Eileen that I could probably do a webinar just on these three stages because they're significant and they're very difficult. And I've actually done a lot of work with people, kind of helping them come to terms with being disabled, dealing with the financial element and try to improve that in any way we can. And then emotionally, yeah, that's the toughest piece. It took me quite a long time to deal with it, to accept it, because nobody wants to file for disability. Nobody wants to not be able to work or continue their career. So that's something maybe down the road we can do that in a future webinar and discuss that. Next slide.
Yeah. So initially, obviously, you're going to have to file, and there's two ways that you can do that. You can actually do that online. You can go to www.ssa.gov, and there's a section for apply for disability. Whether you do it inline or in person, you're going to have the following information. All of your medical information, so your doctors, hospitalizations, medical conditions, medications, and everything down to what was your last appointment with the doctor, what is your next appointment. So it's kind of very specific, so it's a good idea to gather that information beforehand, whether you're going to do it online or in person. You're also going to need the last 15 years of your work experience, okay? So that's going to be dates of employment, what you did, not only what your title was, but what exactly your duties were. If you do it online, you don't have to do it all in one sitting. You are able to put in some information and then save it and go back at a later time, but you're going to have all that information whichever way you decide to do it. And I just thought I'd like to have, when John applied, he decided to do it in person and he had an interesting experience. So maybe he can talk about that.
Yeah, as I was saying earlier, it is probably the most difficult decision I ever had to make in my life. You know, I had a very lucrative career, and the last thing I wanted to do was file for disability. But, you know, just as I was telling you earlier, I had to, because I was literally dying on the job. So, being a very social person, I decided that I would go in and file for disability versus doing it online. And when I went in, and I was sitting waiting for the gentleman to take me into his office, you know, when the woman said, "Okay, you go ahead and go ahead." And I was very nervous, of course, because, you know, even though you have to do it, the whole process is, and that's why I do the advocacy work I do, is because I really didn't have anyone to help me other than Kathleen. So I go in, and the first thing out of the man's mouth is, "You're disabled?" Like that, questioning me. And I felt my fingers and my hand turning into a fist. I literally was going to punch the man and knock him over the desk, but I realized that wasn't going to get me my disability approved. So what I did do was, it just came to me. Never really thought about it, but it just dawned on me. And I said to him, "Sir, let me just tell you about just part of my disability, why I'm disabled." I said, "Think about the last time you had a bad cold and you ached all over, you had hardly any energy, you felt really lousy, but you probably forced yourself into work or school or wherever you were going." I said, "That's how I am 2 to 3 days a week." I let him soak that in, think about it. And I said, "Now think about the last time you had a bad flu. You had really pretty much no energy. You probably just getting up from the bed to go to the bathroom was a feat. You ached from head to toe, you're dizzy, and it's just terrible. It's just a terrible feeling." Well, I told him I feel like that 3 to 4 days a week. At that point, his face was beet red like an apple, and he said, "Please sit down." And in the rest of the appointment, interview, whatever you want to call it, he was very gracious, and at the end, he thanked me for explaining to him what an invisible disability is. Next slide, fine. Thanks, Eileen.
So one of the things that John and I did when he was applying is we wanted to see what we could do up front at the initial application for him to get approved or for people to get approved. Because most people are actually denied initially. They're actually usually denied the second time, and it's at a hearing that most people are approved. But we wanted to see if we could do certain things to kind of have it as much as possible at the first stage. So these are some of the things that we put together.
I love how she says we, but mostly me. What happened was I was really worried and nervous about, do my doctors understand that I'm disabled? And are they going to have supportive information to support my claim? And then I thought, geez, how am I going to make sure I can get approved quicker? Because like Kathleen said, it is very difficult to get approved, but because of the steps I'm about to show you, it greatly improved my chances, and I actually got approved within 5 months, which is unheard of. So filling out the SSI and SSDI forms, it's really, really important to make sure you answer their questions, as best as you can. But when you do, mention your limitations, mentioning that you're limited in doing this or limited in doing that. You want to specify that in the forms. And whenever you get a chance, because they need to understand your inability. Because Social Security, what it comes down to, is your ability to work 40 hours a week for a year or plus. And if you can't do that, you are disabled. So make sure that those forms are as complete, as accurate as possible. If you do mention it, they usually ask you how many hours you use the computer, or what chores you do, household things. I tell people, try not to give numbers. Try to say more that you do light chores or light computer work, because what they try to do, and I don't want to make them sound like the bad guys, but they try to hem you into a certain number and then try to say you can work. Okay. State funding programs. It's really important wherever you live, because we have 50 states, but it's almost like 50 countries, because every state is different. They're different as far as what financial programs they have. They're different as far as what insurances they cover and what's covered and what's not covered. So it's really important in your state, whether you're filing for SSI or SSDI, to see what the state offers. You can Google it, put your state in, say, your state aid programs, whatever the state name is. I suggest strongly to get involved and find out and talk to your governor's office and their staff, your local state representatives, and your federal representatives, because it's a great opportunity for you to not only get help with disability and support services, medical support services, but also teach them about your condition, which is a win-win. Support letter, that's also very key. The Marfan Foundation does a wonderful support letter, and Jan Lynch is who you would be writing to, and Eileen will give you her information later. And that support letter basically will state what the person's health condition is, and discuss how limiting and disabling that it can make them. So it's, and coming from a national foundation, it's very, very strong. And through my work with the foundation, the support letter isn't just for Marfan syndrome, it's also for Loeys-Dietz and Ehlers-Danlos syndrome. So it's a huge, like Kathleen, the judges actually give it a lot of props. Doctor support, wow, that's huge. 50% of the reason why people get approved or don't get approved is their doctors and what the doctors say. Now, everyone should get a copy of their medical records, or at least look at them online to see if there's anything in their records that you don't agree with, something that they said that isn't true, something that was, put in the ER because the ER, they sometimes say things that they really that are held up as gospel when it's not, because an ER doctor is not your doctor. They're just an emergency room doctor. Yeah. So
I'll just take on the next two. Because we're dealing, mostly our audience here is those with a rare disorder, I usually suggest that you do some research and submit some medical information regarding your condition. Some medical papers. There's certainly a lot of that available online. That's important because obviously if it's a rare condition, you're average person at the Social Security Social Security Administration probably does not know anything about it. So, you know, you need to educate them. John talked about doctor support, which is key. And a lot of people say to me, well, my doctor said that he will not write a letter saying that I'm disabled. And my response is, that's fine, because Social Security actually does not put any weight on a doctor saying one is disabled. They say that it is the Social Security Administration's position as to whether or not you're disabled. What a doctor can do is speak to your limitations. I actually have a form that I use that goes through, you know, everything that is important for someone who is in the workforce. And, you know, if the doctor fills out the form, it can state what your limitations are. And basically that's huge in developing, you know, why you can't work a 40-hour work week.
Medical records, this also goes along with doctor support, is people ask me, John, how do I get my doctor to be supportive? How do I get my doctor to understand what I'm living with, my limitations? And honestly, it's not as difficult as it seems. What I suggest to people is to write out a statement. And the statement basically is your limitations, but showing what your life is like, your daily life. So that's what I did. I should say a quick story on that. When I was filing, I was very worried about what doctors would say. So when I sat up one night and I go, gee, I'm going to write a statement of what I live with. So I wrote things like, you know, I can't stand or sit for long periods of time. I have daily pain, and I mentioned the areas that I'm in pain. I mentioned strong fatigue, and I can get more fatigue with low exertion. I packed a wallop when it came to what I wrote. In fact, when I brought it in and I gave a copy, and actually I read it to my cardiologist, he almost cried. My ortho doctor, he even got emotional because he was like, wow, he goes, you live with this is terrible. But because of that, it got into my medical records, and also not just on disability, but medical side of this, they become advocates for me, and they understood, but more empathetic. Now, is everyone going to be like that? No, not all doctors are going to be like that. But if you have a doctor that's not going to listen and not going to care, then you've got to get somebody else. You've got to move on. Anything else about medical records? Okay. Daily Journal. She's bossing me around now. Well, approved cases in your state. You missed one. Okay. So as far as cases in your state, what I mean by approved cases is if you know people in your state that have won a case in your condition, talk to them, because they can help you as far as what they had gone through. Plus also, they may have an attorney in their state that they used and was very good, and because that's really important to have an attorney that understands and has won a case in your condition. The Daily Journal is a journal that Kathleen asked me to keep one when I was filing, and I looked at her and thought, you know, what am I, like a little girl or something? I'm going to keep a journal. But what she was right is you would write down things that are happening during the day, how you feel with things like, you know, I couldn't take a shower today because I was so weak. I didn't have enough energy, you know, where healthy people can't understand that because they think it's easy. It invigorates you. Well, it doesn't us who have strong fatigue. And mention things about, you know, possibly, you know, whether you fell, issues with your pain and other things. We can go to the next slide.
So I have early approval as possible. The Social Security Administration has a set of regulations. They're actually called the listing of impairments. And Eileen, I think you can go to the next one. Next slide.
Thanks, Eileen.
And I've actually had questions earlier as to whether or not Marfan is on the disability list. And the listing of impairments, Marfan actually is there. However, as you can see, originally the listing was that first paragraph, which is, you know, extremely narrow of a definition. In order to be approved under these listing of impairments, and again, the listing of impairments are disorders, diseases that would make you automatically eligible if it meets the definition that is in the listing. So here, basically, you have to have an aneurysm that's not being treated. And as John said, you, in that case, you might be dead.
Right.
So that wasn't really, as far as we're concerned anyway, an appropriate listing. The Marfan Foundation, and I believe John was part of this, actually,
Dr. Grimma.
Yeah,
She did it.
and Josephine Grimma, actually went to Social Security and tried to get a better listing. What they were able to do is get this, basically a commentary. And you can go to the next slide, Eileen. And so the commentary basically, it says that, it tells the judge or the Social Security Administration that, this is a multi-system disorder, and that you also have to look at all of these other areas as opposed to just the aorta. So, that has helped somewhat. However, it's still not perfect. But maybe that's something we can work on in the future. EDS, Lowe's Dietz, they are not in the listing of impairments. There's many rare disorders that are not in the listing of impairments. However, if something's not in the listing of impairments, it's not the end of your case. If you could go to the next slide, Eileen. If you're not in the list of impairments, Social Security Administration, and then the judge, if you wind up in front of a judge, is supposed to determine your residual functional capacity. And basically, they are said to take everything into consideration, okay? All of your physical ailments, all of your mental limitations, and after reviewing all of those, what exactly is it that you could do, if anything, in terms of a job? So a lot of people are actually approved under the residual functional capacity part of it because they're not meeting one of the listing of impairments. I had a question earlier, someone who has, they thought they had Marfan's, but they actually, or they have a child who has a psychological disorder. And absolutely, that is something that can be considered disabling. So, I would suggest that that person certainly pursue applying for Social Security disability. It's not only the physical, but it's the mental. And one of the things I want to add is when you are applying from the very beginning, you have to include absolutely everything that is happening with you. So it's not just Marfan syndrome. Maybe you have scoliosis. There's if you have EDS, maybe you also have POTS or mast cell. So all of these things have to be brought to their attention, including the psychological part of it. My experience has been that people with chronic pain, as a lot of us do suffer from, also have depression or anxiety. I think it's something that goes along with it. So in some cases, not all cases. So this is something that definitely has to be brought at time.
And there are some conditions that are in the listing of impairments, and absolutely there's some psychological, anxiety and depression is far more recognized than most things are of health conditions. But Kathleen made a very major point as far as absolutely listing all of the conditions that you've been diagnosed with. Having Marfan or Ehlers or any other condition doesn't necessarily make you disabled, because that's not, someone could have Marfan's and live their whole life. I know someone that's 85 that has Marfan's, has had very little issues. So it's really what it comes down to is the limitations, the problems, and what makes us get approved is proving the limitations and the combination of all those conditions and how disabling they make you. So you may not have something that is in a listing of impairments, but it actually will get you approved. Now, the other thing I want to say real quick before we change slides is, I know some of you are probably wondering about the compassionate allowance list, because I lobbied for that with a couple of different organizations, and some have been very successful, and we're hoping at some point to get Ehlers-Danlos and Lowe's Dietz listed, but it's going to take time, and that's why a lot of you and I sent information into Social Security, and we did petitions, and that will come. That will come. Yeah.
Okay, next slide.
Thanks, Eileen.
So these are the stages after your first application. Again, you apply, it's usually about 3 or 4 months before you receive a decision. A lot of people are denied at the first stage. Unless you are going to hit a listing of impairment right on, there's a good chance you're going to be denied.
Or you're on the compassionate allowance list if one of your conditions is on there.
Then you go into reconsideration. Reconsideration is basically just someone else at the Social Security Administration looking at your case. And again, a lot of people are denied it at that level as well. That's probably another 3 months to get a reconsideration decision. Then you appeal again and ask for a hearing in front of an administrative law judge. First of all, that can take a year, if not more. It depends on the part of the country to actually get to the hearing. But we're lucky here in Boston, it's usually a year or under, but there's some parts of the country where it's 2 years. We're going to talk about the hearing a little more, but that's really the key in terms of when you're going to be able to present your case and, hopefully win at that point. If you don't, you can go to the appeals council. As with most appeals, they're difficult. That takes another year for the appeals council to determine whether or not the judge's decision at the hearing was appropriate. After the appeals council, you can actually go to the United States District Court. Federal court, you have to have a legal issue that's pretty strong, I would say, in order to get through and get approved at that level. At any point, you can apply again, all right? But what happens when you apply again is, you're losing retroactive benefits. So, that can be important in some cases. So the next slide. So once again, the hearing is probably the most important part of this process. It's important that you're prepared. I do suggest having an attorney at this point. It is under oath. It's an evidentiary hearing. There's witnesses potentially, so this can be important. And if you're going to have a lawyer at any point, this is where you need it. Again, preparation is key. We'll talk a little more about, choosing a lawyer, but you have to have someone that's working with you throughout this process to get to the hearing and is familiar with you, with your condition, and is prepping you adequately to go into the hearing. You can have witnesses, family members, something like that. You don't want necessarily the witnesses to be redundant in terms of what your testimony is, but you are allowed to call witnesses. The hearing itself is pretty informal. It's usually in a small room. There's a judge, there's a hearing officer. Again, we'll talk in a minute about medical experts and vocational experts. But it's not a courtroom. It's not like anything you see on television. You're not going to be cross-examined. The judge is there to gather information from you. But you are under oath, and it is an important part of this process. Medical experts are rare. However, usually, truthfully, the medical experts for Social Security are probably either not experts. They're certainly not experts in Marfan's or EDS. They may or may not have heard of it. And usually, I'm usually happy when I get a medical expert because, after 12 years of going to conference, I probably know a little more about Marfan syndrome than your average, general practitioner. Vocational experts are often there, and the reason for a vocational expert is for the judge to ask whether or not, based on your testimony, there are jobs that you could do. They do that in the form of a hypothetical question. So the judge will say something to the vocational expert, like, if you have someone of the claimant's age, education, work experience with the following limitations, are there jobs that they could do? And then, of course, if you have an attorney, you can cross-examine the vocational expert. So once again, that can be an important part of it. You can go to the next one. So I just wanted to, I think we have a couple more minutes. And before we get to questions, there were some questions previously about lawyers. And first of all, I always tell people, choose a lawyer the way that you choose your doctor, okay? You have to be comfortable with them. You have to be comfortable that they're supportive of you, that they're gonna, work hard on on this condition or work hard with you to achieve this. Someone asked whether or not you can get rid of a lawyer that you're not happy with. You can. You have the right to have whatever lawyer that you're comfortable with. They don't necessarily have to sign off on it. There would possibly be an issue with the two lawyers about the fee down the line, but that's really not your concern. You should have a lawyer that you're comfortable with. I mentioned retroactive benefits. So basically what happens is from the time that you're deemed disabled, okay, or with SSI at the time that you apply, you're going to get benefits up until you're approved. So you'll get all those benefits in one retroactive check. And the way that an attorney charges is they take 25% of that retroactive money. So you don't have to pay them up front. And all lawyers, according to the Social Security regulations, have to charge that way. So, that's, if anybody suggests something different, that's not correct.
And what I try to stress is that the things that I've been talking about and the things that I mentioned already about, building evidence, providing information, supporting of information. I've gotten a lot of people approved before they got to the reconsideration stage. So that way the money all goes to them because I don't charge for what I do. I charge no fees for my services. Yeah, go ahead.
Okay, and just to briefly address some of the other questions that I had, someone talked about the fact that they can work, but they basically have no life outside of that. Unfortunately, if you're working and you're making more than $1,000 a month, then you're not going to be deemed disabled, okay? So that's why the decision to apply is so, important, because you're not going to have an income for probably a year or two. So that can,
I believe that person mentioned working 20 hours. Now that 20 hours is not over, but it's $1,100 a month.
right, it's 1,000. 1,000 give or take. It changes every year.
Okay, and you can, a lot of people said this, and I hate when I hear this, you cannot work if you file for disability. That isn't true, because you have to pay bills, you have to do things, just as long as you meet those requirements that we just stated.
And then someone else mentioned that they have long-term disability benefits through their work. And what happens when you have those type of benefits through work is the company that sponsors the benefits will hire a lawyer for you to get Social Security benefits. And someone asked, well, isn't that a conflict since, they're the long-term disability company is paying me, and they have an incentive for you to get Social Security. The long-term disability company does, because there's going to be an offset. So basically, they're going to be paying less in your long-term disability payments if you get Social Security. So that's the way that works.
I'm going to use the last 6 minutes on the other stuff, because she usually manipulates the whole. When we speak, I have to grab the microphone away from her. But I want to cover a couple of things early on when you file. Don't get discouraged when you get that first letter of rejection, because that's almost automatic. They want to see if you're going to walk away. I know it sounds nasty, but some people don't realize that they should really continue, and it's just a part of the process. So, please don't get discouraged by that. And then that's when you would appeal. And at the appeal stage, it's a lot easier than the first stage, because you're basically saying, yes, I want to appeal it. And then there's steps you should take to improve your support information, like we had gone over earlier. So, anything else you wanted to? Maybe we can get to questions early, or do you have anything else you wanted to?
I guess one other question that I had earlier was, someone is now elderly, 74. He was diagnosed with Marfan's in his 20s. He never applied for disability because he was told he wouldn't get it. And the question is if he could still apply for disability. You're only eligible for disability up until your retirement age, your full retirement age, which, 66, it changes often. So the answer to that question is no. But more importantly, what I see sometimes is people will stop working and they keep on thinking that they're going to go back to work, and all of a sudden it's 5, 7 years later and they realize they can't, and they apply for Social Security disability. Your retroactive benefits are only going to go to a year before you apply. So you're not going to get 7 years if that's how long you've not worked. You're only going to get that retroactive for a year before you applied. So that's, sometimes an issue that comes up. And the other thing to keep in mind is if you stop working, the further you go from the time that you've worked to applying, your insured status can be in jeopardy, okay? So we talked in the beginning how with SSDI, because you put money into the system, you're insured, as they refer to it. But that only kind of continues as long as you're still working. So some people get into a position where they never applied and all of a sudden their insured status has expired. So now they have to go back and prove that they were disabled a year or two ago, which can be quite difficult.
Another thing a couple of things I want to add is please, please, please write to your legislators, state and federal, especially federal, regarding the incredibly low maximum for SSI and SSDI. People can't live on those ridiculously low amounts. So do what I do and just write and talk. Well, actually, physically, if you can, go in and speak to them. And if you have to, good idea to pull people from your state, all go in together because you're voters, you're their constituents. It's important to do.
So John, we have we have about 22 questions.
Okay.
So you guys have given such awesome information, and I see the questions piling up here. So
okay, no problem.
I think you've answered most of the questions that were sent in ahead of time, but questions that we've got tonight. Okay.
Okay.
Somebody was a stay-at-home mom when she became disabled with EDS, and she was told that she can't get SSI because she hadn't worked full-time for 18 years. Is it true you have to be working full-time when you become disabled?
That's a situation of which I just spoke. It's not that you had to be working full-time, it's that her insured status had lapsed because she hadn't worked for so long.
Okay. How about getting SSI for a child?
Getting SSI for a child, the process is similar. I guess the only difference is, they also look into how the disability affects his or her performance at school, his or her interaction with other children. So there's a couple other things that'll be evaluated.
And that's where the doctor comes in. Make sure your doctors are aware of their needs.
Okay, here's a question specific to California. I'm not sure if you're able to answer this, but somebody would like to know if they can receive both SSDI and California State Teachers Disability if you've worked in both public education and privately. Or is that
you can, as long as you've put into the Social Security system. So basically, some teachers, and again, I'm not familiar with California, they don't put into Social Security because they have a disability and pension. But if you've done both, then you could. I guess the only question would be if you put into disability a while back, your insured status may have lapsed.
Okay, great, thank you. Another question, I got denied for the third time. My lawyer said he can no longer represent me on my case. I have 30 to 40 days to file an appeal. What should I do? Appeal on my own or find some help?
Well, try to do both. I mean, try to find help, but just keep in mind the appeal date, because if nothing else, you got to get it in by then, and then try to find someone to help you.
Okay, this one, I think you covered all this, but let me just throw this out there. My husband was denied SSDI through his initial application. His appeal is in front of the judge, and now we're in the process of the next appeal. This is all through an attorney. If we lose this next appeal, what is the next step? Now, those are the 4 steps that you gave us earlier, correct?
Yeah, if you're not successful at the hearing, then you go to the appeals council, which is basically just them looking at, it's not a court appearance. They just look at what the judge did to determine whether or not the judge was correct.
Okay. What do you recommend for those who are denied? Okay. What do you recommend those who are denied can do to help increase their chances, especially if they're denied and they truly are doing this out of it being their only option? The Journal of Symptoms, I think John talked about, getting a letter from a doctor. Is there anything else, or just go through that list that you guys posted earlier? Yeah,
the list is important, and the key is the doctor support. That's absolutely the most important thing.
one thing I thought that was really key that John said was how when he really described how he felt, and he didn't just say I felt bad. He really painted a picture of what it truly felt like, and it sounded like that it was really compelling because it was very descriptive and really painted a picture of, you know, just what his day was like. And so that probably, when you're doing your journal, that's probably good to think about.
Yeah, that's an excellent point, Eileen, and that's something, you know, you have to try to do in the hearing is, you know, get people to say, you can't just say I'm in pain or I feel tired. You have to give specific examples so the judge will, you know, will get it.
Okay. Can you speak to applying for SSDI for adult children disabled before the age of 22? So we talked about children. Now this is like adult children. I guess you're talking about like older teenagers, college age.
So basically what happens is if you can prove that you were disabled before the age of 23, then you can actually get benefits off of a disabled parent or a deceased parent. And it winds up being more than just SSI. So if that's your case, and if you can do that, then, you know, that's key. The problem becomes when some people decide to apply when they're 30 and they're trying to prove that they were disabled before 23, you know, then it becomes difficult.
There are several people wanting to talk to you privately. So I know at the end of this presentation, I know we'll have a contact email up, and also John and Kathleen are available through Jan Lynch in our office will certainly connect you. So
absolutely.
What about Medicaid? Is this related in any way? Is it the same way with Medicaid?
Yeah, so if you get benefits for SSI, then you're going to get Medicaid, okay? In some states, that's kind of the only way you can get Medicaid. You know, that's not the case here in Massachusetts. You know, we have people that are working that can get Medicaid or Mass Health. First of all, if you get SSDI, you'll get Medicare, all right? And if you get SSI, then you'll get Medicaid. Medicare is what you get when you're older and retired, okay? Medicaid is for lower income individuals.
Okay. Here's a good question. My current, well, they're all good questions. So this is something a little different. My current employer does not know that I will be applying. Will they contact them once I apply? I don't want to jeopardize my job.
They will not contact your employer. The problem becomes that you will not be deemed disabled if you're working. So they're not going to look at your application if you're currently working, because if you're making more than $1,000 a week, you're deemed not disabled.
That makes sense.
$1,000 a month.
In terms of your doctor letters, does it carry more weight if you're at like a Marfan, a place that's known for Marfan expertise, like maybe one of the clinics on our clinic directory? Does that hold more weight than if you're just going to a random doctor?
It should. Yeah, go ahead.
Yeah, but you have to argue that, or your attorney has to argue that, you know.
Right.
Like I've been lucky enough to represent people that have, you know, had Dr. Liang and different, you know, excellent doctors. And I even actually had Dr. Liang testify at a hearing for me. He's just amazing. But yeah, one of the first things I did was make sure they knew exactly what his background was, and that, you know, he's a foremost expert in Marfan syndrome. That's very important.
Okay. Can you apply while you're on short-term disability?
Yeah, if you're, so the standard is that you're going to be disabled for at least a year, okay, in order to apply. So you can apply on short-term disability if you think that you're not going to go back to work. Yeah.
Okay, so if you have a chronic aortic dissection and multiple aneurysms and get approved on that basis, what happens if over time your whole aorta is replaced? Will you lose benefits?
No, because there's, you know, obviously there's going to come other problems, you know, as you go. You know, Marfan's is progressive.
And not just Marfan's, Kathleen, like
Yeah.
other conditions have aortic issues. But
Right.
the added to that, what Kathleen's saying is that, you know, it also depends upon the limitation, because I know a lot of surgeons, and I have to always remind them, just because you did the surgery doesn't mean that they're all better.
Right.
You know, they have other issues and other problems. So it comes down to the limitations of the person.
Right.
Okay, if you are receiving state teacher's disability and you are approved for Medicare only through SSDI, not a monthly payment, are you allowed to earn more than $1,000 a month and still retain Medicare?
Interesting question. I'm not positive, but I would assume so, because you're not receiving. I guess it would go to what exactly the teacher benefits call for.
Right.
That would probably be in their policy.
Yeah, so check the policy, and also you can also call Social Security just to bounce it up to them as well.
You had mentioned earlier about looking for an attorney to help you the same way you would look for an experienced doctor. Is there a list somewhere of preferred attorneys that specialize by state? You know, somebody's asking specifically about Michigan, but really, you know, I think anywhere people would want to
You want me to
know.
answer that, Kath, or you?
Yeah.
Yeah, I'd say no, because I wish there was. I really do. I really wish there was, because there are a lot of lists you'll find on, if you Google, but they're paid for lists. Their law firms will pay to get on this so-called list, and so to answer your question, no, there's not. But the best way to find a good attorney in your state is to really talk to the support group people that are part of a support group in your state that have the condition, and ask them who they use and who they recommend. Same thing with doctors.
And you have to interview the attorney, just like, you know, you would not interview a doctor, but I mean, you have to be comfortable with them. You have to be comfortable with that they're going to advocate for you. You have to be comfortable with the fact that they're going to learn about what your disorder is.
Right.
So, I mean, that's
if they show no interest in wanting to learn, they don't show any interest in what you give them, and this goes for both doctors and lawyers, then they move on, because they're not going to be vested.
And there's, you know, through the Marfan Foundation, that's not only just about contacting Jan, as John said, through support groups, and whether there's a local support group, people you can speak with locally, in person, maybe there's a Facebook group for people in your area, or just online forums. We have Connect, which is through the Marfan website, and you can reach out to people there and find people from your state and ask them about attorneys and get find out about their experiences as well. So we offer a lot of ways for you to connect with other people, and this is just one more thing that you could speak with people about that would really benefit you and learn from other people's experience. Great question. Okay, I've recently been approved for full Medicaid. I'm 46 and they have deemed me disabled. I have my SSDI hearing coming up in April. Will this approval for Medicaid help my case?
It won't hurt it, but they're going to look at it like, you know, they make a decision based on what their regulations are, but it's certainly not going to hurt. And I would certainly make sure that that's brought up to the judge. Okay.
If you own a home, or if you may inherit one, can you protect it if you or a descendant gets disability? How does SSI affect it? I guess looking at what your assets are, does that matter?
Yeah, so SSDI, it doesn't matter what your assets are, money in the bank, anything like that. SSI, it does matter. What you can do if you're going to be inheriting money and you have SSI benefits or want to apply for SSI benefits, is have someone put the money that you're going to inherit into a special needs trust. And you would want to see a lawyer who's experienced in that in your state in order to do that. That would protect your inheritance, and it would protect it so that you could still continue to receive benefits under SSI. SSDI, it doesn't matter.
Right.
Here's a question. I think, you know, you did address this a bit in talk when you're talking about what qualifies you for being approved, but somebody said they don't have a Marfan specific diagnosis, but Marfanoid diagnosis. Maybe it's emerging Marfan. And so again, that's really about talking about what your limitations are, how you are affected, and what your daily life is like, regardless of what the diagnosis is, correct?
Exactly.
Correct.
Exactly.
Correct.
Okay. Does the combo of Ehlers-Danlos and POTS usually qualify for SSDI?
And no, it comes down to, once again, limitations. So it's not, even though POTS is extremely disabling, think of it as limitations. So if you can prove your limitations, then that's really what's going to get you approved. Not really, unless it's something, and POTS is not included in the listing of impairments, of course, and neither is EDS. And someone did ask, well, how can we get that done? Well, that's going to take work by the different organizations individually to deal with Social Security.
Okay, here's a question. How do we find advocates like John who can help us and are either part of the organization or part of the Marfan community? That's absolutely impossible. There was nobody like John. And so I'm sorry about that. And he will be spread very thin after this call, I think, tonight. But he is willing to help as many people as he can. Is that right?
Yeah, I definitely can, and there's definitely some good advocates in each state. That's why I definitely, like we mentioned it, Eileen mentioned, I mentioned the support groups. There's some people that are just dynamic. I've learned so much from a lot of the members of the different support groups, Marfan and Ehlers-Danlos, Liz Dietz, Turner's, Taxia. It's just, I mean, it's sticklers. It's amazing what kind of information you can get for advocacy.
Okay. All right, the questions keep coming. We definitely have at least 5 more minutes here. So there's somebody with Loeys-Dietz syndrome looking at a 3rd heart surgery, and they've had a lot of surgeries, a lot of medical problems. She wants to know, do the amount of surgeries make an impact? You said Loeys-Dietz is not on the list, but again, it's describing your limitations and what you're going through every day, correct? Or
yes.
Does this amount of surgeries, is that going to help tell your story?
I mean, you're going to use both, but yeah, it's all about limitations. It's certainly not going to hurt that you've had to go through, unfortunately, so many surgeries. Loeys-Dietz is pretty serious condition, so there's certainly a good chance that person would be approved.
Okay. Can you get Social Security disability insurance if you have not started working?
Not Social Security disability insurance. You can get the SSI, Supplemental
Okay.
Security Income, but that's going to be based on your assets and your income, your household income.
Yeah, but don't they mean disability insurance or policy? I think that's probably what they meant.
Oh, you mean a private policy?
Yeah.
This is complicated for amateurs, so
yeah,
it's good for you guys to keep explaining. I know, I realize some of these questions might be a little redundant, but I think,
that's
for
okay.
a lot of us, we're trying to understand.
It could be a disability policy. That is not, they do offer, like I have, I don't even know what I have. What do I have? Globe Life or something like that. It's very small policies. I'm actually, sorry, I got a brain fog. That's life insurance.
No,
Is that
disability insurance?
Oh, disability insurance. Okay, sorry. Disability insurance is different. Yeah, sorry. I just went off on a tangent.
John got disability insurance many years ago, before he knew what Marfan's meant, before he had a dissection. So in order to get a policy that's not through work, and if you have a diagnosis of Marfan's or, EDS, it might be a little difficult, but, it's worth a try.
All right, here's another interesting question. This is about a young woman who has Loeys-Dietz, and she's been on SSI since the age of 1, and she turns 18 in April. Is it hard for children to requalify at 18 as adults who are applying for the first time? She just requalified at age 16, but will be reevaluated at 18.
Unless her condition has improved, then it shouldn't be difficult. I mean, it's kind of like the same evaluation. So.
Okay. What if your doctors have retired or moved and the records are not available?
Well, you have to start getting treatment from, current doctors.
Right.
Social Security always says, well, it doesn't matter if you don't have a lot of medical documentation because, we'll send you to our doctor. Well, no, forget that. You need to have medical documentation. So whatever you need to do to get that is the first thing.
And one thing real quick, if you're someone, and there are many in the country that I've helped that don't have family, or that some of them are homeless, how do you get insurance? Because a lot of states don't have proper insurance, proper health insurance plans for people who have limited income. That's when you use the free clinics. That's when you go in and have find someone that's willing to listen and help you, and they'll build up the medical records for you.
Oh, somebody else also asked that about how to see doctors. So I'm not working, I don't have insurance. And I just want to throw out there that, the Marfan Foundation Annual Conference is a great opportunity. We have scholarships for first-time attendees, people who really need access to top doctors. And you would get that at our conference. And conference registration will be going up this week. You'll watch for the announcement, and you can apply for a free clinic assessment, and those doctors can certainly help you start building your case.
Good point. Excellent point.
So many people are asking the same kind of questions, so I just want to emphasize again. People are asking, are writing in about what their diagnosis is and how can they best become eligible or approved. And I think the most important thing again is telling your story, right, and how you're affected and what your limitations are, regardless.
Yeah, and also if they have anxiety and depression, if they have a diagnosis that is in the listing, or it can be somehow worked into the listing, that can help greatly. Orthopedic issues, anxiety, depression. What else can you think of, Kath?
Yeah, I mean, I always tell people, don't be concerned about the diagnosis. I mean, we all know so many people that don't have a proper diagnosis. So,
right.
Just worry about what your quality of life is, what your limitations are.
And make sure everyone understands that, doctors especially.
Right. Okay, I think let's make this the last question here. What if you're self-employed and your business brings more than 1,000 in 1 month, but averages less than 1,000 over the year? And we haven't talked about self-employed at all, so.
Well, with self-employment, you have to make sure that you're putting into the Social Security system. So that would be the first thing, whether or not you're eligible. And in terms of income, I mean, it would be what you actually take home. So it would be what you're bringing in minus your expenses would be what your salary is, right?
Right. So. Okay. All right. I think we're going to need to end that there. It's about 1 minute to 8. So there's more questions, and we will certainly try to get more answers from John and Kathleen, and look for them in places like Connective Issues on our social media. This is an ongoing problem, and I know as long as we stay on the phone, people will still have questions. So maybe we'll do this again as a follow-up, or maybe focus in on that one area John was talking about earlier about the financial and emotional and health considerations. So with that, I just want to close by thanking John and Kathleen for sharing all this great information with us. You can all go to marfan.org for more information. Contact Jan Lynch. Let me get her contact information up here. There's Jan's information, her email address, and her phone number. She heads our help center. She can answer questions, and if she doesn't know, she can find out from John. She can connect you with John and Kathleen, and I know they work together very well. And Jan and John and Kathleen have a good thing going there. So, certainly you can reach out to us, and we can all get and we can get your questions answered. Our next webinar in this series is on March 27th, and the topic is self-care and empowerment strategies. And Jan Lynch, who I just mentioned, is the presenter. You can register on our website. Again, thank you all for participating today. Watch for the survey tomorrow in your email. We definitely want to hear your feedback and your suggestions for further topics for these webinars. So thank you again for listening, and thank you, John and Kathleen. And
thank you, everyone.
Thank you, Eileen. Take care.
And
bye-bye.
We'll see you all next time. Thanks. Bye-bye.
Bye.